Thank you so much, John Ruetz, to agree to talk to us today about the work that RCN, Réseau Compassion Network, is doing at a national level with CHAC. And then to just start, we're going to ask you to say your full name, your title, and since when you're working for CHAC. And if you can say CHAC at like the whole
Sure
name, that would help everybody.
It's a pleasure to be here. I'm John Ruetz. I'm the president and CEO of the Catholic Health Alliance of Canada, which some people refer to as CHAC. I've been in the role since July 2020. I had to think about that for a minute.
2020.
So just over 5 years.
Okay.
I've worked in the Catholic Health Ministry and sponsorship for about 10 years.
Can you explain to us how and why was created CHAC?
Sure. It's a complicated story and always challenging to try to summarize in a few words. I think it's important to remember for over 400 years, there's been health organizations with Catholic identity in Canada. And pretty much every one of those organizations was formed by religious women. So Catholic sisters across the country. 400 years is a long time. And it was in 2011 when the Catholic Health Alliance of Canada was formed. And it was at that time that we realized that the transfer of sponsorship from women religious to new church entities called public juridic persons, which was a bit of an experiment in the late 1990s, that transfer of sponsorship was largely complete. So what the Catholic Health Alliance of Canada is, it's a collaborative of 13 of these public juridic persons who come together nationally to form what we would call the national table, the collective of organizations with responsibility for 129 health organizations with Catholic identity in Canada today.
So that's what we call the sponsors.
Correct.
Is that correct?
Yes. That's right.
Okay. So what is sponsorship of Catholic healthcare institutions?
So I thought the first question was hard to answer in a few words. This one could be the full interview. What I like to do is start by saying at the highest level, sponsorship is all about ensuring the mission and Catholic identity of our organizations continue, but not only continue, but is lived within those organizations. So you might ask then, well, what does a sponsor do if that's the high level goal? And I would highlight a few things. The first big responsibility for sponsors is to appoint the people who serve as the board directors in each of those 129 health organizations with Catholic identity, provide those people with formation and education so that they know that they're part of a 400 plus year legacy and they now have some responsibility to have Catholic health care continue. And that formation and education can just help them be a little bit more effective in their roles. And we also want to provide for those people a safe place for them to come together, to have discussions, to talk about priorities, to talk about thorny issues, to see each other as a peer network and a place where they can talk together, collaborate, and get ideas. And then finally, and very importantly, the sponsor has a role to provide advice and guidance and sometimes direction to those organizations based on national priorities and what might be happening locally. And when all this work is being done, it's really important to keep in mind the core purpose of what Catholic health is really all about. And at the center, it's a very simple yet profound statement, and we learned this from the sisters. What are the most pressing community needs in your local area? And what is the sponsor and its sponsored organizations doing to help address those needs? And we have an expectation that all of our organizations at some level have a strategic platform or a pillar related to that identification and response to unmet needs.
So how many sponsors in Canada, and do they work all the same, have the same role and responsibilities, or there is disparity? I don't know if disparity is the right word, but like the major difference between them.
One of the cardinals that we work with at the Vatican, the Holy See, he met with us a few years ago, and he said, Canada is very diverse and never lose that diversity. And he said, unity that destroys diversity is not unity. So when you ask me that question, that's the first thing that comes to mind. And we very quickly took that to heart. And we talk about unity, not uniformity. So there are 13 sponsors that make up that national table that I speak about. We're very unified. We have great friendships, great working relationships, yet every one of those 13 organizations is autonomous in its own right, and there's no expectation that every sponsor is going to function exactly the same. So we see a lot of differences across the country, but we're consolidated and unified by a common agenda and a common wish for Catholic healthcare to continue to survive and thrive and do well.
So is each province have at least one sponsor, or that doesn't work like that necessarily?
Not necessarily. As much as we're coast to coast from the Pacific to the Atlantic, we no longer have health organizations with Catholic identity in every province. Those provinces that do have presence of Catholic health, some have one sponsor, some have multiple sponsors. So no particular formula.
Okay. So today, in 2025, can you explain to us what's the role of the Catholic Health Alliance of Canada?
Yeah. So again, and I'll continue to stress the importance of coming together around this national table. And as big as Canada is, and the footprint of Catholic health in Canada is significant, we're a small enough group where we have come to know each other really well. So we have this collective, and when you ask, well, what does the Catholic Health Alliance of Canada do? The first commitment we have to each other is to hold each other accountable for mission fidelity. And that's a fancy way of saying, are we really doing what we say we're doing? And one of the things that I would highlight is in the last few years, we've developed a self-assessment and peer review process for sponsors, where every sponsor is holding themselves to the same standard, assessing themselves against that standard, and asking for some of our peers to come from other places in Canada to say, well, what do you see as the benefit of outside eyes? And what this has done is it has helped us develop only now in the last few years what we call a national scorecard. We have a real clear sense of strengths across the country, areas for improvement, and in some cases, a strength in one area in Canada might be an area for improvement in another area. So it's creating a great opportunity for cross-fertilization where initiatives can be shared amongst sponsors and we can learn from each other. I would also then highlight that at the national table, we have chosen a generative conversation approach, which means we're very much about dialogue and communication. And together, we're always talking about and agreeing what are the most important things that we should be focusing our time and energy on to benefit the national advancement of Catholic health in Canada. And then, of course, from time to time, there are emerging issues or risks. And with the benefit of everybody sitting there together and knowing each other well, we can talk through, well, what are these risks? What do they mean? And what will our approach be?
So this is the type of work that the governing council would do, right? So, and that governing council includes representative of all sponsors across the country. So tell us more about his role and how RCN is working with CHAC to ensure that those goals are reached.
Yeah, so what you say is exactly right. Each one of those 13 sponsors selects a person to be its representative at that national table. And the Governing Council is, in fact, the board of the Catholic Health Alliance of Canada. So in my role, I'm accountable to that board and the 13 people that are nominated by each of those 13 sponsors. It's maybe important to say, and it gets at the heart of your question, the Catholic Health Alliance of Canada itself has no authority, zero. So our strength is in the convening role. We have 3 employees, yet we have 13 sponsors, 129 health organizations with Catholic identity, an ability for the sponsors together to say, these are the most important things in Canada. And now how are we going to go about delivering on those priorities, knowing that we're going to have varying degrees of acceptance in the early going, and the way that priorities roll out in different parts of Canada look different from sponsor to sponsor. And that's part of that diversity that we've accepted. What I would highlight, the Réseau Compassion Network has consistently always been very quick to raise their hand to say, we want to provide leadership for this national initiative. And of course, the benefit to Réseau Compassion Network is that leadership can bring about some very good tools that can be used locally in your own sponsorship. What Réseau Compassion Network has done, though, is added capacity so that we can move quicker on the national agenda by getting early adapters like Réseau Compassion Network to not be afraid to jump in, try new things, see how a tool can be developed. And then once we've fine-tuned it a little bit, other organizations might come in a bit later to say, well, thank you for that preliminary work, and now we can roll it out elsewhere in the country.
How is Réseau Compassion Network different from the other sponsors in Canada? And can you tell us, in your opinion, what makes us unique?
Yeah. That's a really fun question for you to ask me, because I have the privilege and pleasure of having gotten to know Réseau Compassion Network in my years in the role. And I think the first thing I would say, and you've gotten at this already with an earlier question, every sponsor is unique. And that's part of the beauty across the country. And then I think, so when I think of Réseau Compassion Network, what comes to mind? And there are a couple of specific differences that I would highlight, unique things that I see in your sponsorship that are maybe just a little bit different than elsewhere. And as I thought about that, one of the phrases that I often hear from your leadership is the Réseau Compassion Network is a modern day expression of the healing ministry. And that's a very powerful phrase. And as I've come to understand it better, it's not just words. This is a guiding statement that I see Réseau Compassion Network has taken to heart and has used to develop its strategy and how it communicates about its work. So the two things I would highlight, the first thing would be the way that as sponsor, Réseau Compassion Network has decided to interact with its network organizations and provide strategic support to those organizations. And my view would be what I'm seeing is, as sponsor, Réseau Compassion Network is assuming competence and has great confidence and trust in the people that they've appointed to the board of the organizations that make up that network of organizations that are sponsored by the Réseau Compassion Network. And it's a very mature approach to sponsorship where the sponsor is saying, we want our network organizations to feel autonomy to fulfill their purpose. And then the sponsor says, what could we do to add value? And I think this is one of the things that is very unique to highlight. Réseau Compassion Network has realized some network organizations do not have the infrastructure to allow them to do certain things. And the sponsor is able to come in with some added value to say, well, maybe there are things we can do whether we can provide people as capacity or perhaps some financial resources to aid in your strategic planning, maybe some seed funding for special projects, perhaps some support for ethical or spiritual care. And that approach has been very well honed and is quite deliberate. And in my interactions with RCN as sponsor and with some of your organizations, I know how much that is appreciated. The second thing I would highlight as unique is the Réseau Compassion Network has made a very deliberate decision to be what I would call a public-facing sponsor. There are many organizations in Canada that would not have a public-facing role. Yet what the Réseau Compassion Network has said is we think we have an obligation to be very present in our community. And what I learn about as Réseau Compassion Network tells that story is it's very analogous to some of the stories we've heard of religious congregations from many, many years ago being invited to come to a community. And some of those sisters have amazing stories that they've traveled to communities by walking for days or weeks, traveling by canoe, taking a train across multiple provinces. And what they always did was consistent. They got to a new place, they looked around, and they said, first, who should we partner with? Who is in this place that can help us in our mission? And then second, which is, of course, the core of Catholic health, what are we seeing as the most pressing, urgent needs in this community? Who are the people who are vulnerable? Who are the people that need help? And of course, the world in Canada has changed a lot over hundreds of years. And we're realizing now, as proud as we are of our institutional history, most of the Catholic health footprint in Canada is institutional based, hospitals, long-term care facilities. If the sisters were to arrive in most communities today, they would not look around and say, the most pressing thing is to build a hospital. The world has changed. So when we come to then Réseau Compassion Network, making this decision to be public facing, they have said very deliberately, we want to be known in this community and we want to be active ourselves as a sponsor to identify and meet these community needs. It's not only our network organizations who will be doing this work, we ourselves will be active in it as sponsor. That's a very motivating and inspiring approach to sponsorship that is leading edge in helping other sponsors to see a possible future direction to be thinking about.
So this is not typical of a sponsor in Canada. This is what I hear, right? This is not, okay, a typical, that's good. So can you tell us one or two area where you feel RCN has made a difference or stands out at the national level? Because now we understand like, oh, we're a bit different here in Winnipeg and Manitoba, but how is it at the national level?
Yeah. I'll highlight a couple of things with pleasure. The first thing that comes to mind for me that really stands out is the Réseau Compassion Network has an absolute commitment to be engaging with people with lived experience and then turning the learnings from that engagement into action. It might be action related to reconciliation. It might be action into what sort of services does this community need based on the real people who have told us this is the gap, this is what they're feeling, this is what they're missing, and this is what they need. That approach for a sponsor directly to be engaging with people with lived experience is noteworthy and something to absolutely highlight. And then the second thing I would highlight, and it ties to a comment that I made just a little bit earlier about making that deliberate decision to be public facing. The Réseau Compassion Network has made a very deliberate decision to choose a model of sponsorship that ensures that Réseau Compassion Network itself is taking action to address the core issues related to complex poverty. And to have a sponsor identify and articulate an entire strategy around a pressing need as macro and as significant as complex poverty is also very unusual. And it's a different way for sponsors to be thinking. So again, it's not only who are the network organizations that we're proud of and what are we doing and how do we support them, but what is the biggest issue in the geography that we're serving? And for the Réseau Compassion Network at a board level, at a team level, to work through a decision to say it's complex poverty, and we're going to be aligning our efforts, our people, and our resources towards that is very impressive. And I see that that's being done in two ways that are quite different. The first way is maybe a bit traditional by asking the question, what new organizations could we create that could become part of our network as a direct result of wanting to respond to complex poverty? And then the second, which is also somewhat unique and a bit courageous, it's taking a less traditional approach to say, how will we provide leadership in this community? How will we bring partners to the table to tackle a very significant topic, issue, or solution? And not necessarily does Réseau Compassion Network have to be the owner of the solution. And not necessarily does the solution even have to have Catholic identity. This is all about, first and foremost, the need, ensuring the need is met, not about control and ownership, but more leadership. And I really think of that word a lot when I think of the Réseau Compassion Network. I see the leadership clearly locally, and we're beneficiaries of that at the national table as well.
What are the biggest challenges then that you are facing right now that requires everybody to turn their attention to?
It's always exciting to talk about strategy and initiative, and you deliberately use the word challenges, and there's always challenges. The three things, and I am always hopeful. I'm a glass is half full person. With challenge comes opportunity. And the first thing, which is maybe something that still surprises me after all these years of Catholic health in Canada, many organizations very successful, it is still a challenge for many people working in the healing ministry, for many people working in a network organization, to tell a story in their own words about what is Catholic health, why is it important to them, and why have they chosen to spend their career or their volunteer time in a health organization with Catholic identity. And we're very upfront to say this can be a bit of a challenging time to speak about the brand Catholic, if I can use that marketing word. There have been some very difficult stories that have needed to be learned and told. Some terrible things have happened that the Catholic Church has been part of. And that sometimes makes it a little difficult, or people might be a little bit shy to speak about their connection with an organization with Catholic identity. At the same time, I truly believe that the people on our teams, the people of Catholic Health, have an opportunity to show the world all this incredible work we're doing to respond to community need, to provide care and service for people who are vulnerable. And this is a way to demonstrate how the church is present in society today. It's not always going to church at 10 o'clock on a Sunday. We are doing the work of the church through our ministry of healthcare. But we really have to help people learn to articulate, again, in their own words. We can't be giving a script to people about what it means to be part of Catholic health. The second thing I would highlight, and this is one of our most important national priorities, which we call welcoming communities. We have learned through listening sessions across Canada that some patients, clients, family members, some of our staff do not feel as safe and welcome coming into a health organization as with Catholic identity as we would like and as they should expect. And there's all kinds of reasons for that. And what we need to do is understand who is not feeling welcome and what needs to change. How can we demonstrate that we are a welcoming environment? I'm often surprised by people who think that you have to be Catholic in order to work at a health organization with Catholic identity, or you have to be Catholic to come to one of our organizations to receive care. And we need to make it really clear that we serve without judgment. And we've learned this from the sisters. Whoever knocks on our door to receive a service that we provide, we welcome regardless of their faith, their race, their life choices, their beliefs. We want them to be welcome. The reality is we have some work to do. And that is something that has to be embraced by all sponsors and by every one of our network organizations. And the third thing I would highlight, and this is partly for us internal to the healing ministry, internal to those working in Catholic health organizations, but also for governments and society. I still get asked by colleagues that I've known in the health leadership world for 30 years, how is it going creating a separate healthcare system for Catholic people? And I want to laugh when I hear that, but
Sorry,
I don't.
I did.
It's very ironic, because if every sister who was part of a founding congregation heard that, it's the exact opposite of what they were trying to create. It was not to create an exclusive place for people with a certain religion or other set of belief, but to meet an unmet need. And that myth is still very much alive in Canada today, within healthcare and within governments. I am shocked to have to say that that's still the case. But we can't go wrong by sticking to some of those simple key messages that Catholic healthcare is for everyone. And we depend on all kinds of people to deliver the healthcare services in our organizations as well.
It's about living the values. And it's about wanting to respond to unmet needs with no regards to wherever the person's coming from or their background, right? So it's really about the values. Okay, so where would you like to see the Catholic Health Alliance of Canada and Réseau Compassion Network in 25 years? What's the road ahead of us?
I'm smiling because the first thing I thought of is in 25 years, I might be almost old. So I wasn't sure I wanted to go there. But I do like the question for sure, and that's a generation from now, and it's a very good way to ask the question. So again, I draw from words I've heard from my colleagues, my friends at the Réseau Compassion Network. So this is a quote from your own people. They envision a world where the communities that you're serving will have an attitude. Call up those people at Réseau Compassion Network. They know how to get it done. And that has echoes of what the sisters were like when they were the sponsors. Now it's our watch. And I hear in Réseau Compassion Network not wanting to be the sisters. We've learned from them. We're going to be a little bit different. But let's strive for that in the same way, that people will look to Catholic health and sponsorship as the organizations that can be there for communities and can get things done. So my 25-year dream is for sure for Réseau Compassion Network, but for Canada. And when I think a little bit further than that, when I do a little bit of a deep dive into public policy and social programs, it's not very far that you have to get with any provincial government or the federal government, where some of the policy platform language is very similar to the language we use in Catholic Health. And we're in a position to go to government, not with an ask to say, this is what we need, but with an offer to say, how can we help you implement your social programming? Because much of that social programming is very consistent with our long-term beliefs and values of what Catholic healthcare, the common good is all about. So a wish that I will have then for 25 years out is across the country, we're seen as a very trusted partner of government and an organization that government will seek out to say, this is what we want to achieve. Can you help us get there? And then my last wish, if I can be bold to add one more, I see in 25 years a hope and a desire that Catholic health will be strong and vibrant and has grown. And in the last few years, we're starting to see the leading edge of growth. So I'm hopeful about that. And we're seeing growth in different ways. So I don't have my crystal ball today. I mentioned earlier that the future of Catholic health expansion might not be hospitals and other facilities. I definitely see there is a lot of space in affordable housing for Catholic health to play a big role. There is probably not an urban center in Canada that does not have housing at the very top of the list of issues. We're in a position to provide leadership. And we may be in a position also to repurpose some land and some buildings that is in the ownership hands of Catholic health or the Catholic Church that might be able to be used for this very important purpose. So I appreciated the question because it kind of gets us out of the here and now to think, well, what are we hoping for? But I think that day of growth and expanded footprint and a go-to place for government to come to for solutions is what I dream of.
So we inherit from the sister of their legacy, and then we're already talking, you guys are working at the national level about how we can also set up the future, what will be our legacy, and then transforming what's in the system right now and make it not better, but like the way that it's going to respond to the needs of the population in the future. And I like that.
You're giving me a good idea. There's a real key message in that. So we started out by catching the torch from the sisters.
There you go.
And the first message was, okay, here's our legacy. It is yours now to carry. They expected us to carry it, though. Not only maintain it, and now we need to be asking ourselves, what will our legacy be? It maybe took us a while to understand, what responsibilities have we taken on to mature, to become competent, and now we need to run.
But that's okay, because those are huge responsibilities, right? So like it took the time that it take to understand and mature it, and now I think you have a clearer idea of what would be or what could be the legacy of the sponsorship in Canada and the Catholic Health Alliance of Canada as well. So I thank you very much for this. This was great. Anything else you would like to add, John?
It's been a real pleasure. I would just conclude by offering congratulations, and it's a privilege that I have the ability to bring that congratulations, not just on my part and the Catholic Health Alliance of Canada, but on behalf of the entire healing ministry across the country. We're very fortunate to be connected, to have Réseau Compassion Network as a longtime member of the Catholic Health Alliance of Canada, and not only sitting at that table, but providing leadership. So it's been a real pleasure, and I'm very happy to be part of this anniversary celebration.